Did you know that over 280 million people worldwide suffer from depression? It's one of the most common yet misunderstood mental health conditions. Many people think depression is just feeling sad, but in reality, it's much more than that. It can affect your mood, your thoughts, and even your physical health. It's not just about having a bad day, it's a persistent state of despair that can last weeks, months, or even years. In today's video, we're going to explore everything you need to know about depression, what causes it, how it affects the mind and body, and most importantly, what you can do to manage and overcome it. What is depression? Depression is a mental health disorder characterized by a persistent feeling of sadness, hopelessness, and a loss of interest in activities you once enjoyed. It can interfere with daily life, making even simple tasks feel overwhelming. Unlike temporary sadness, which is a normal emotional response to life events, depression lingers and can worsen over time if left untreated. It's linked to chemical imbalances in the brain, stress, and even genetics. Some people experience depression as a result of life circumstances, while others may have a biological predisposition to it. Depression is categorized into several types, including major depressive disorder, persistent depressive disorder, also known as dysthymia, seasonal affective disorder, and bipolar disorder, which includes depressive episodes. Each type of depression has its own symptoms and treatment approaches, but they all share a common impact. They can significantly affect a person's quality of life. Causes of depression. There's no single cause of depression, it's usually a combination of factors. Some of the most common causes include brain chemistry. Depression is often linked to an imbalance of neurotransmitters such as serotonin, dopamine, and norepinephrine, which regulate mood. When these chemicals are out of balance, it can contribute to feelings of sadness and hopelessness. Genetics. If depression runs in your family, you may be more likely to experience it yourself. Research suggests that having a close relative with depression increases your risk, although environmental factors also play a role. Life events, stressful or traumatic experiences, such as losing a loved one, going through a breakup, financial struggles, or workplace stress, can trigger depression. Hormonal changes. Hormonal fluctuations can affect mood and contribute to depression. This is especially common during pregnancy, postpartum, menopause, or due to thyroid disorders. Medical conditions. Chronic illnesses such as diabetes, heart disease, or autoimmune disorders can increase the risk of depression. Substance abuse. Alcohol and drug use can worsen depressive symptoms, leading to a dangerous cycle of dependence and worsening mood disorders. Social isolation. A lack of social support and meaningful relationships can contribute to feelings of loneliness and depression. Humans are social beings, and when we lack connection, our mental health can suffer. Symptoms of depression. Depression affects everyone differently, but some of the most common symptoms include persistent sadness, emptiness, or hopelessness, loss of interest or pleasure in activities once enjoyed, changes in appetite, leading to weight gain or loss, sleep disturbances, including insomnia or excessive sleeping, fatigue and lack of energy, even after a full night's sleep. If you or someone you know is experiencing these symptoms for more than 2 weeks, it's important to seek help. Depression is treatable, and early intervention can prevent it from worsening. How depression affects the body and mind. Depression doesn't just impact emotions, it can also affect physical health. Long-term depression can lead to weakened immune system, making you more susceptible to illnesses. Increased risk of heart disease. Chronic stress and anxiety can put strain on the heart. Digestive issues. Depression can lead to nausea, loss of appetite, or irritable bowel syndrome. Chronic pain. Many people with depression experience unexplained aches and pains. Cognitive decline. Long-term depression has been linked to memory loss and difficulty processing information. Increased risk of other mental health disorders. Anxiety disorders, substance abuse, and eating disorders often co-occur with depression. Treatment options for depression. The good news is that depression is treatable. There are multiple approaches, and often a combination of methods works best. Here are some of the most effective treatment options. Therapy. Talking to a therapist can help you identify negative thought patterns and develop coping strategies. Cognitive behavioral therapy, CBT, is one of the most effective forms of therapy for depression. Medication. Antidepressants like SSRIs and SNRIs can help balance brain chemicals. However, medication should always be taken under the guidance of a healthcare professional. Lifestyle changes, regular exercise, a balanced diet, and proper sleep can significantly improve mood and overall well-being. Mindfulness and meditation. Practicing mindfulness can help reduce stress and improve emotional regulation. Social support. Talking to friends and family or joining a support group can help you feel less isolated. Healthy routine. Establishing a daily routine with small, achievable goals can provide a sense of structure and purpose. Alternative treatments. Some people find relief through acupuncture, herbal supplements, or light therapy for seasonal depression. Journaling and self-reflection. Writing down your thoughts and feelings can help you process emotions and track progress. When to seek professional help. If depression is affecting your ability to function in daily life, or if you're having thoughts of self-harm or suicide, it's crucial to seek help immediately. Professional mental health support can make a huge difference. Remember, seeking help is a sign of strength, not weakness. Final thoughts. Depression is challenging, but it is treatable. If you found this video helpful, make sure to like, subscribe, and share it with others who may need it.